I'm delighted to introduce our speaker this evening, Dr. Sherilee Harper, who's a very respected U of A faculty member, and she's tackling one of the world's most significant and urgent challenges, and that is climate change, and in particular, climate change and the impact that it is having on human health.
In Canada, there was a study done mainly by Health Canada authors, and they found that short-term exposure to wildfire smoke led to anywhere from 54 to 240 deaths per year in Canada. Clearly, climate change is impacting wildfires, and wildfires are impacting our physical health. And I gave examples of respiratory health and cardiovascular health, but it also impacts our mental health. So if we can understand and recognize that climate change is not just an environmental issue, it's not just an economic issue, it's something that impacts each and every one of us, that can really inspire climate change action.
I mean, is our river going to dry up? Are we going to have a lot of flooding? Or is drought going to be an issue?
The climate that we live in today is completely different than the one that we lived in 10 years ago. But at the same time, our infrastructure, our policies, our public health responses and health systems are basically built for a climate that no longer exists. So what does the future look like? I don't know. More extremes. We know that there's going to be more extremes.
Even with all of the technology in the world, even that a mighty university like U of A can come up with, we also need to think about how our behavior impacts climate change. So how do we motivate people to change how we live?
Looking around our sphere of influence and who we know and how we can bring people together to respond to climate change collectively. So how do we do that? Well, research has shown that the most important thing you can do is talk about it, is to talk to people about climate change and make it personal. Talk about how it impacts their day-to-day life. Does it impact their ability to access the outdoors or to exercise outside? How does it impact them and how does it impact their health? Another really important thing to do is pay attention to politicians' climate change platforms. And then once they're elected, to keep them accountable to those platforms. And that's from the municipal level to the provincial level to the federal level as well. Tackling and addressing climate change will require both technological innovation, but also social innovation. And it doesn't matter which IPCC projection model you look at, both are required. We have the climate change solutions available, and yet we're very, very, very slow to be taking them up.
What can healthy seniors do to reduce the risks of the effects of climate change?
During a heat wave, staying inside, staying in cooled places if you have access to those, cooling your hands, your feet, and your neck is also really important. Checking in on your neighbors is very important to make sure people are doing okay. You could say the same thing about wildfire smoke. Staying indoors when you're outdoors, using a mask is really important. Paying attention to air quality indices. And I think those are important for seniors, but they're important for everyone.
I think that wraps up all of our questions for today, but I want to thank you for a very engaging conversation. We're very proud of the work that you do here at the University of Alberta, and we're really lucky to have you here as a colleague and doing such meaningful work that is having such an impact around the world.